it'll. All right.
So, good evening, everybody. Welcome. My name is Alma Lowry. I'm a fire captain with San Diego FIRE-RESCU Resource Officer. And with me this evening, I have Captain Brent Brainard. He is our wellness officer, and he works in the health and wellness office of our department. He is our COVID guru, I guess you could call him. He is the one that is all knowing of the happenings from the start of COVID back in March of this last previous year up until now. So I was going to introduce to you Captain Brent Brainard from San Diego FIRE-RESCU.
Thanks, Captain Lowry. So a little bit about myself, like what Alma said. I've been a member of the department for 19 years. I've had a very blessed career. I've had everything. I've worked through all the ranks up to from an EMT to a captain. And then my latest assignment, like what Captain Lowry said, was I'm in the health and safety office as the wellness officer. So basically my overall responsibility is the physical and behavioral health of our membership, of our members. So, and part of that was before COVID hit, I had a dedicated infection control officer. So with that, I was responsible for anytime someone got a bloodborne exposure, aerosolized exposure. And it was just a little side gig. And then once this pandemic hit, it went from a little side gig to in my PowerPoint presentation, I'll show kind of where it evolved to, because like with anything, and like with anything with COVID, it's radically changed everything from our department's lifestyle, our behavioral health, families, how we interact with our families. So like with everything, all the way up through to today, the health and safety office has stood up.
Hey, Brent, can I pause you for 1 sec? Dr. Morris needed to say something really quickly. I apologize.
Good, sorry. I just started. Tell me to go.
Let me start by saying welcome, Dr. Lowry, or Captain Lowry, and Captain Brainard. It's a pleasure to have you here. My name is Tim Morris, and I am the member of the American Lung Association Mission Committee. We're going to start off with a brief message from one of my board members, Tony Gwynn.
The American Lung Association has been saving lives by preventing lung disease and promoting lung health in our local communities for more than 100 years. And today, achieving health equity is at the core of everything we do. We believe everyone should have the same chance at healthy lungs and clean air, but we all know that too often those families with the most to lose get the least access to quality health care, the finest hospitals, and even clean air. This is one reason we've launched Community Connections, free, interactive conversation with San Diego healthcare professionals and medical experts on the health topics most affecting our communities. My fellow board member, Dr. Tim Morris of UCSD, likes to call them dinners with doctors. For more information about weekly topics and more, please visit lung.org/events. I hope to see you there.
Well, thanks, Tony. And again, my name is Tim Morris. I'm from the American Lung Association, something called the Mission Committee. And what the Mission Committee is a group of volunteers in the various different professions, including the medical profession and the fire and rescue and environmental health and things like that. And we organize ourselves to try to help the Lung Association recognize healthcare needs and direct its resources. So let me start off by saying this is Happy Clean Air Day. And it is a day, especially in California, where we try to recognize the importance of clean air. And there is an opportunity for you to take the pledge, a clean air pledge. And if we can put that little QR code up on the screen, if we don't get it up now, it'll be up in a second. But you can hold your phone up to that QR code and you can take the clean air pledge. As far as tonight is a part of a series that will be happening every Wednesday for the next few Wednesdays, and we did a series like this in the spring, and we're doing the same thing in the fall. It's every Wednesday. Last week we spoke about COVID on each side of the border. Today, we're going to have Captain Lowry and Captain Brainard talk about how the first responders responded to the pandemic. Next week, we'll be talking about lung cancer screening during the pandemic. Then another week with Captain Lowry again, talking about the health effects of wildfires, certainly a timely topic now. After that, we'll have Dr. Welsh be speaking a bit about COVID among children, adolescents, and college students. We'll have a biology lesson after that on November 3rd with Dr. Evan Snyder and Dr. Susan Liebel-Sanford. Liebel from the Sanford Burnham Medical Discovery Institute. And then we'll have a discussion about the county's response to COVID-19 after that. Then finally a talk about maintaining your healthy lung in your mind and your body as well throughout the pandemic. Tonight, however, we have Dr. Captain Lowry, who served over 2 years on the Fire and Rescue Department and was on the front lines of the COVID-19 response. And we're also quite fortunate to have Dr. Brent Brainard from the he's the health and wellness captain from the department, and he's been with the COVID team since its inception. We're going to have them discuss this a little bit, and then as usual, about 40 minutes into the discussion, we'll invite panel members from the Lung Association Mission Committee and try to have a nice roundtable discussion. So once again, Captain Lowry, Captain Brainard, welcome.
Thank you, Doctor, for that introduction. I apologize, I jumped the gun on you.
It's good to have fire to people that want to run into, act now. So
That's so once again, my name is Alma Lowry. I've been with the department for about 21 years. I am the current community resource officer for San Diego Fire-Rescue, and I'd like to introduce to you Captain Brent Brainard. He is the wellness officer. He serves under the health and wellness office in our department. And I'm going to turn over the reins to Captain Brainard.
Thanks, Alma. Like Alma said, my name is Brent Brainard. I've been with the department for 19 years. For the last 3 years, I've had the privilege of being the wellness officer for San Diego Fire-Rescue. It's an incredible position. I work in the health and safety office, and our entire mission is to take care of San Diego Fire-Rescue members. So like what EMS is to the public, we are to the membership. So we do physical health, behavioral health, cancer resources, basically the health and safety committee, anything that can help firefighters respond better and more efficient to the general public. That's our entire mission. So one of my ancillary duties, and I like to joke about it, was the infectious control officer was always the one like, okay, you have it. It was kind of bounced around and finally landed in my position about 7 years ago. And it was always this little ancillary duty. Hey, you sit on these committees, you kind of do a couple of things, but it wasn't that much until January 2020. They went from an ancillary duty to when we were watching COVID start to rise, myself and my boss, Chief Bacconi, it went from a couple hours once a week to, okay, we're 5-6 hours to a full-time job. And it's radically changed what we've had to do in the wellness, in the health and safety office. So I got a couple of slides to present. I'm just going to preference it. The presentation, the kind of the way we're looking at presenting this is from when we started, kind of what the incident command structure looked like, how we address the initial, because that's a lot of the questions we get is, what'd you guys do when it first started back in March of 2020? It's funny because it's like everybody either knows today or March of 2020. And so I'll briefly talk on that, then some of the ongoing topics. And it'll just kind of take the veil away a little bit, showing that, yes, firefighters, we're the ones that show up on the worst days. We're the ones that will be there taking care of your family members when they're hurt, sick, injured, fires are going. But we also have we're dealing with the same realities of, are we going to take this home to our families? How's this going to affect us personally? How's this going to affect our station? We had to dramatically change a lot of like our station life and put down our heads. So I'm going to share my screen right now, and then we'll kind of go through. It's only 9 slides, and we'll end with how San Diego Fire and the city did the vaccination clinic at the end. Make sure, is it the San Diego Fire-Rescue COVID-19 response up? Okay, perfect. So quick little facts. It was first identified late 2019 in Wuhan, China. It was declared public health on January 30th. It was deemed a pandemic in March of 2020. We put together an incident management team. The incident management team, we looked at multiple facets, and basically this is what our objectives were. Objectives are basically our metrics to guide what our incident management team does. And basically, with as rapidly as the things were changing, we ended up having entire sections devoted to taking care of the fire personnel, because we couldn't, and the messaging and the direction we got was, we have to keep our personnel safe so we can go out and take care of the general public. Like if there's no fire, there's no like 911, like 911, you call 911, we come. We have to fix it, whether it's some hazardous material, radiological, a structure fire, heart attack, no matter what it is, we will always come. And so our mission was, when we put this together, was okay, we're dealing with something that no one in our career has ever seen. So we need to be able to take care of our personnel and get them back in and keep the fire engines and the ambulances and all the staff, the hazmat teams, the rescue teams, because 911 calls were still coming in. We still had to go take care of it. And then also when we would go out, to make sure that we were protecting ourselves from the public and the public from ourselves. Basically, what was the proper PPE? So these were the objectives. So basically provide the treatment and care for our folks. The other thing is we know is if our firefighters and emergency personnel are distracted because they're worried about the house, what's going on at home, they're not going to be able to provide 100%. And that kind of dives into my normal job, which is the behavioral health, and which is my true passion. And what I love about my current assignment is the behavioral health. How do we take care of it? So we encompass the whole holistic approach to it. Then it's the continuity of emergency operations. Okay, half our department's sick. How do we still provide that same level of service? We have it broken down, and part of the mission of this incident command team that we put together was, we broke it all the way down to, okay, going on specific calls, how do we, but still maintain that coverage that our citizens demand and are entitled to and should have. Safety and operational guidance. I think one of the best memes, and I couldn't find it, was it showed Chris Farley with his hair all crazy. And it's like the EMS personnel processing the 30-second policy change in 4 days. But that was our reality back then in March. We were working 16-hour days, and literally we would start the morning with a certain guidance. By 10 o'clock, we'd had revision 2. And by 4 o'clock, we're saying, everything we've said, stop. So the craziness of that time, it really built in a lot of resiliency, because it showed not only the fire department, but our general population, the world, and everything that, yeah, we can go through this and we can come out on the other side. We can, put the stuff in place to basically survive and go through this. The next one was the operational plan to respond to incidents with limited resources. That's what I was talking about with continuity operations. And then the last thing, we are always vigilant about our costs. Basically, we want to make sure that everything the public is entrusting us with financially, we are investing it, utilizing it wisely, so that if we ever get audited, if we ever get asked why or any of those issues, we can always attest that we have been basically appropriate with our funds. This just gives, not a lot of people get to see the behind the scenes. So I know a lot of times with some of the other speaking things I've done, this is not a fully expanded incident management team. This is what they would consider a type 3 or a type 3 short. It goes all the way up to a type 1. Just for instance, like when the space shuttle came apart during re-entry, a type 1 incident management team came out and managed that. That's no different than a type 1 incident management team on a forest fire. These are all hazards teams that we could put across that were moldable. That's the one thing about like the fire service is, and especially like, our department does an amazing job, is we can take something, take a look at it, and we can apply, okay, hey, we're doing this. Like we stood an incident management team up in 12 hours for a pandemic. It's never been done before. So things of that nature are pretty cool. And if you look into this, you'll see, I think you see my cursor, but we're looking at intelligence, because we're looking at, okay, case rates, where things are happening. This is over here. and this was my area, and we were looking at data, because data drives what we do. The better the data we have, we found early on data was a priority, because we were able to track trends, see what things were going on. We pretty soon found out that not only what we were going through, we mirrored the entire nation. When we hit a spike, when the nation hit a spike, we hit a spike, and our data was almost completely accurate for what we saw. And all the way down to, just giving you an example, infectious control group. Basically, those are the call takers. Those are the ones taking it. It was myself and Chief McConey before March 13th. This we put together. I pulled one of the earlier incident management teams. We would get about 2 to 3 infectious control calls a month. That's what Chief McConey and I would average. We were averaging 30 in a day, a call exposure per day. So at one point at the beginning of it, I literally had both my phones, because I have a work phone, personal phone. I sat them down on the table, and they both wouldn't stop ringing for 20 minutes. And Chief McConey, we literally sat next to each other, and that's, it was March 12th, no, March 15th, excuse me. We all sat there like, okay, we're not this, and that was one of the catalysts to start this. So I think, but everything from situation, we were putting videos together, so the firefighters would always have the first thing. I just want to this was one of the pieces we put out, the medical aid zones. We actually zoned it out like we would a hazmat incident, because we took, and a lot of the stuff we've learned through this, we're still applying to today. How can we better provide? We actually took this as a learning experience. And this is from like scouting going in, full PPE, having the paramedic gown up, if there was a COVID experience, and all the way back into the support zone. So we had different levels so we could adequately take care of the public. So then things have obviously changed, but the one thing I can say is our department, we learned a great deal of information about this. So some of the issues I counted, I briefly talked about it, is the change in department lifestyle. We were a very, like you see, these are what we call Class Bs, like our badge, we have all our fancy stuff on here, our names, but we learned that we were taking these into medical aids, and these were exposure risks. So changing that. We're a very social organization. Firefighters are naturally the social, like our kitchen table is where we, where we have our meals, but we also have our meetings there. Everything's centered around our kitchen table, and not a lot of people know that. So the interesting part was we had to now separate. So instead of having our coming in, have our meetings, or it wouldn't be uncommon to come back from a call at 2, 3 o'clock in the morning, and everybody would go congregate to the kitchen table and just start talking. That's where we would do our debriefings. And when I say debriefings, that's like the crews would take care of ourselves. And so we were starting to experience, hey, no, you can't do that. You have to stay apart. Like, okay, you come in, you put your stuff on the rig, but go to your room. You only come out when you shop. And then we had to start looking, instead of like brothers and sisters, like what we were used to doing, which is coming in, it's our family away from home. We spend up to a half of our life with the same group of people between all the overtime and stuff that we do, up to half of our life. And now it's like, no, you have to stay away. So we were experiencing, I don't want to call it loss, but it was changing everything dramatically. And then now started to put where, people would get sick, so we're having to do force hires. Now they're away from their own personal family. Now you see your friend get sick, and can I take this home? There's a lot of us up at the incident command post that we would stay like in another room. I did. You didn't know what was going to happen. We didn't know what was going on. We were around 60 people a day trying to keep it safe. And then we started realizing, well, if they take us out, then what? So the department lifestyle was so dramatic that we had to adjust, that we were experiencing some behavioral health. So they actually pulled me out and put me in my normal position to deal with peer support for the department. Because one of the things I deal with is I run our peer support team, I run our chaplain corps, and I also manage our psychological contract for our folks. And so when we were taking that out, we actually did, one of the things we did during this time was we did a study through Drexel University on the effects, and they were profound. We were able to get hard data from from a study we did to show the folks that, hey, this is affecting our mental health, our behavioral health significantly. We were from the experiencing a loss, the nervousness, the anxiety was through the roof. But the one thing I can say is we always got on the rig. We always came out, and we always put our best foot forward for the customers, which is the public. So this is, and I always like showing this because it's a behind the scenes of every time you see a fire engine show up, there's a huge machine behind it. We were, like myself, Captain Lowry, and the massive support structure that we have behind it. So every time a fire engine pulls out of the fire station with 4 people on it, going lights and sirens, they are at their top. And that's the whole mission. And one of the things I had to talk about burnout was that was real. Like what the joke about Chris Farley, but at the end, especially because our incident management team ran about 2 months. Then we transitioned it down to the COVID division. And then from the COVID division, we transitioned it back to normal. So like logistics typically supplies the PPE. It went back to logistics. I went back to my normal function, which was taking care of, I basically took what I was doing with taking care of the firefighters, the health and safety. I kept that, and we just brought it back, and we just basically have upstaffed the health and safety office. Well, now we're going on about 20 months. So we have still have about 5 or 10 people still working to take care of the firefighters, because our firefighters still getting sick. They're still coming back. We haven't had one firefighter get admitted into the hospital. We haven't lost one firefighter to COVID. We've had the successes and what we have. I'm looking forward to, I apologize when I say this, but when this is all over, because that everything changes with that. We don't know. We don't know what tomorrow's going to bring. But getting someone with a lot of letters and stuff behind their name and taking all the data we have to basically kind of say, okay, we have data, but what does that look like? How are we successful? Where could we learn for the next time, and basically write a pretty good AAR after that. The burnout, like I say, is it's real. I've experienced it. Pretty much everybody in our department at one point has experienced it in the COVID, because things could change. But the thing is we always have to be resilient. We always have to address the behavioral health issues. Even if you haven't experienced the behavioral health issue, you just don't, when I say people just haven't understood it. Learning about behavioral health and taking care of yourself, knowing when to talk, having a trusted confidant and things like that is huge, because if you as an individual, and I'm not talking about Brent Brainard as a firefighter, I could be talking about, any person with any individual profession, because everybody contributes. They have to be at their top whenever they're either at home, with their family, whether they're at work, driving, whatever it is. We always have to constantly be checking, how are we doing? And then look at the different resources we have, because behavioral health, especially with the COVID fatigue, and any of the other issues that you described or have come from it, it is a real thing. So, and then the last thing I want to bring up is vaccinations. I was fortunate to be the operations section chief for the city's vaccination efforts. So this is one of those little infographics, and I apologize, this is still in draft form. We're still, just with everything going on, we haven't had a chance to truly finalize it, but it has a pretty good thing. We started December 31st. We got thrust in. We went from about 8 days from when they said, yes, you're going to start, to when we started providing vaccinations. And we ended May 28th with the general public. Through that time, we were just a hair under 80,000 vaccine doses provided. That's first shot, second shot. We went off site, everything from the vaccine equity to total workforce. We had 274 firefighters trained, firefighters, lifeguards, whether it was EMTs, paramedics. So we had 274 vaccinators trained. We had 472 city staff or volunteers that worked down at the site. So and you see there was a variety of numbers. We had all 3 vaccines going through the same time. So we had a very successful program. And the cool part about it is Balboa Park has a very storied history. And it was when we were looking at selecting a site, it seemed very, the words drop escaping me, but coming back to Balboa Park. And I won't go into it right now, but if people want to Google the history of Balboa Park, it's pretty unique. So that's a lot of what I had to say as far as like just San Diego Fire Rescue in kind of a brief short time. I'd be open to answer any questions. Captain Lowry, do you have anything to add?
I don't. Captain Brainard covered a vast majority. Captain Brainard was kind of behind the scenes when the pandemic did hit in March. I was on an engine company working when the pandemic hit, and the behavioral health that he talks about, it's real. A lot of us had children that were sent home from school and were having to homeschool. We were caring for our elderly parents. There were some real challenges ahead of us as a department for our behavioral health and wellness. And that's why I brought Captain Brainard today, because he's just such a wealth of knowledge on that. And he really took care of us as the boots on the ground out there. Us captains, taking care of our crews, doing regular check-ins with our crews, making sure we were all okay, mentally, physically, all of that. So that's what we have for all of you. And we're more than happy to answer any questions, either of us.
Thank you both. I'd like now to invite all the members of the mission committee that are participating to come on in and join our panel discussion. And let me first start off while that's all happening by telling you both how much your community really appreciates your efforts. And we're really in awe of what you did over the past, seems like 100 years, but the last year and a half. If I wish there was some way that we could express just how grateful we are to you. I actually remember there was a time when the first responders visited the hospital, because in the hospital we're all locked up and et cetera. And there was one time when there was an announcement that we're all called down to come outside the emergency department. So everybody that could did, and we went down outside, and you all were out there, and you turned your sirens on just to to say hello and show a little sign of support. And there wasn't a dry eye in the crowd. It's even kind of emotional right now to talk about it, because you're our heroes. You were out there in the fight right on the front lines, and to have you guys acknowledge what was happening in the hospitals, it was really quite awesome. And I remember after you guys left, it was just everybody was sitting there in kind of shocked silence. So thank you again very much. And my first question actually has to do a little bit with that, and we'll get into your fascinating history in a second. But I'm often I think nowadays about the World War II and D-Day and all that kind of stuff that happened with our parents and our grandparents, and what they had at the end of the whole thing. They had VE Day and VJ Day, and they had ticker tape parades, and the sailor and the nurse kissing and the whole schmear, And I wonder whether the same thing is going to happen somehow, or how that's all going to get celebrated out from the people like first responders, because you guys did heroes work, but I don't know, is there going to be any ticker tape parades for you?
I am unaware of anything. Captain Brainard, do you know? Or
I don't know. I'm just personally looking forward to when everybody's back together.
Yeah. Well, I guess the reason I'm asking that was it wasn't necessarily a specific question about an event, but I have a feeling about soldiers that return from action, and I know that they often will go through some sort of post-traumatic stress, and some of that is related to saying, I went from action to suddenly back here, and there isn't kind of an acknowledgement of what it was like and what we went through. It just seems like, people don't want me to talk about it, and they just want to move on. And I'm wondering about that in first responders, whether first responders might be vulnerable to that feeling of saying, when the pandemic numbers go down, the crisis goes down, the world would just as soon, move on and not think about it. And I wonder whether there's some, concern about whether those people who are out there in the trenches for all this time, letting they put in their lives on the line, are going to feel like they should be acknowledged somehow.
I think it's the one thing, like, what, at least speaking for myself right now, we got into this, and like we becoming a firefighter, paramedic, and what we've done through this whole entire time has been, you know, how do I say it? We're actually the ones that gravitate away from the limelight. We have a, it's funny when I've written someone up in a good way to someone, we have to surprise them, because we would tell people like, hey, okay, hey, you're gonna get a division citation. They take the day off. They don't want it. Like, it's just that's our mentality. We go up, we show up, we do our stuff, and we go home. And that's it's something that has always originally drawn me to the fire service. And speaking for myself, it's like, you don't look, none of us have ever, I mean, of course, there's a couple of glory hounds, and you know the ones that are just like, hey, look at me, like they're the ones out running around. You're like, okay, like, let's just pump the brakes, pal. But for the most part, I can speak for probably 95% of the workforce, is when we show up, and the things that mean the most to us is like after we take some, if we take some to the hospital, just letting people, when they sit there, say, hey, thank you. That's it. And then we don't, or when we get to the hospital, you'll see us high-fiving, and it's like, we brought someone back. That to us. And then, there's about 7 or 8 calls that I can remember where we showed up, they weren't breathing, the hearts wasn't started. And by the time we got to the hospital, they were trying to pull the intubation tube out. You come back 4 hours later, they're sitting up talking. And those are the ones where you sit there, and when you go home, you're like, you can be up the rest of the night, doesn't matter. But that to us is like, okay, I did make a difference. And that for me has always been the only validation, like anything I've ever wanted, because that is why we put our bodies through this, the graphic stuff we see, the mental health issues we deal with. It's because when we come home, we want to know we made a difference.
Nice. I wondered about that. I'm aware that firefighters will call each other brothers and sisters, and I wonder about whether that is some way of supporting each other through some pretty emotionally draining times, and your respect for each other is the thing that carries you through a lot of this stuff.
That's exactly what it is.
So I have some practical questions, just because I and none of the folks on the line probably have that much experience in doing what you do. But one thing, an easy question is, it seems like our impression is that firefighters and rescue people are kind of, there's always somebody there. And so, it's a 24/7 type of thing, and pandemic or not, the same thing was happening. But did you have an actual increase in hours? Did you have to staff up, or put, double the amount of people in, on work at work each time? Or was it pretty much the same number of hours that you worked any other year?
So for people like myself that was actually at the incident management team, we're your standard Monday through Friday. I don't work on a fire engine routinely. But that we ended up, like, and you're talking specific, like back when it started. We started with, when we started the incident management team, we ended up doing 16-hour days for about 2 months straight, 7 days a week.
Wow.
There was about 4 weeks I didn't see my house in the daytime.
And so, for us working out in the ranks on the fire engines and the fire trucks, we almost wanted to work the overtime to help each other out, to help our brothers and sisters out that weren't, either if they were home on quarantine or to cover them. We wanted to do it because that's just our nature. That's what we do. But there was almost like not a panic, but there was definite times when, we're like, okay, are we gonna be at full staff at this engine company for the day? How are they feeling? Are we going to have to, create an overtime position? So those are all really very real things that did happen in the very beginning of the pandemic.
I know for people that worked inside the doors of the hospital, if one of us got an exposure to a patient who, and the exposure was when the physician, the nurse, respiratory therapist wasn't having PPE on, then that person would usually have to go through a quarantine. But I'd imagine that you might have been had a much higher chance for accidental exposures in doing what you do. Did that have an impact on your workforce that, somebody would go out and you were doing, CPR on somebody or something like that, and then you later found out that they were COVID? Would that take out a whole team?
No, so I believe it was March 30th. Remember I was talking about all the different policies. March 30th, 2020, I believe it was March 30th, Governor Newsom signed an executive order. And basically it came down to symptomology. So if you were symptomatic, then that's when our trigger point was to pull you off. So up until that point, so basically if you're in isolation is for sick people to keep them away from the healthy people. Quarantine is they're healthy, but they're exposed. So we're quarantining that. So on, I believe it was March 30th, don't quote me on the date, but when Governor Newsom signed that executive order, that's when we kept our workforce going in, but that's when we really started re-emphasizing all the don't sit at the kitchen table, eat in shifts, stay in a room, don't go on training. Basically we shut everything down. Like it was the first time we hard shut everything down for our entire workforce. So when we were experiencing it, it was just like the standard waves throughout the entire year when people would get more, when we get more sick, actually sick firefighters, then we would start depleting our staffing and more people would get forced to work. And then when that would go away, so basically whenever there was a wave come through, we would see the exact wave. I would literally watch how many firefighters would come in and out of our isolation. And it was completely mirrored the nation, the world.
Now, I have a question also about how you would prepare your personal protective equipment, because I think that again, I'm going to contrast a lot of what you do outside the doors of the hospital, what happened here, but we typically had an awful long time to prepare ourselves. And if we were outside the door of somebody that we knew had COVID, then people wanted to put PAPRs on or would do whatever, and but we had a chance to prepare ourselves, and also we had lots of help, and we were in a very controlled situation. But how did you handle times when I know that you have to go out into the field and go through sometimes a bit of an adventure just to get to the person you're trying to take care of, run upstairs or do something like that? How did you handle the PPE under those types of circumstances?
Alma, do you want to, since you're an officer for that one?
Yeah. So what was really fantastic about our dispatch center is when we would call triage a call that would come in, the dispatchers built in protocols, and they would ask questions, kind of just your general COVID questions. And if they met the criteria, it would show up in our notes, in our fire engines and in our computers, and it would, notify us of the questions and how they were answered. So based on that criteria and the captain's decision, we would dress out our firefighters in the back seat. So our gloves, mask, eye protection, gown, head to toe. And like that map Captain Brainard sent up of the hot zone, the warm zone, and the cold zone, wherever that patient was the hot zone. So we would send in one firefighter, do a quick assessment. It would be the paramedic. That paramedic would radio back to the firefighter that was waiting at the door. The engineer was standing by with the ambulance crew, dressing them out head to toe, the transporting unit. And the captain was overseeing safety for everything. So based on the demographics of the patient, we would either send in that firefighter that was fully gowned. They would collect the patient, put them on the gurney, do the turnover to the medic crew, and we would slide the patient in, patient turnover would happen, and then our paperwork would happen. So we would document every patient that we would come in possible contact with. And we had a system for that. And the PPE was then disposed of properly. We would decon our boots, whomever set foot in the residence. We would spray them down. It was a whole new way of life for us. I don't like sending in my firefighters in the back seat into a home that I'm not able to get my eyes on, see who's in the room, who's behind closed doors. I've been caught sometimes, I know this sounds really bad, but with my pants down before, and I don't do a good house check or house assessment, and there's other people in the home that are, I can't really get into much, but you can imagine, you know, having somebody peek around a door and you have no idea that there's another person there. So it left me a little bit uneasy, but I made sure that my crew was very well prepped, like do a good quick assessment in that house, see who's there, see who's not there. You know, loading the patient's demographics. If it's a code, then we're all going to be submitting paperwork. We had really great communication with AMR, our ambulance provider, and with our EMS staff. And like Captain Brainard was saying, there was just ever evolving things that would happen. You know, oh no, we're not doing this anymore, but we're doing this, or yes, you're documenting this, but not that. And we really took care of each other like that. And these ambulance crews, we were extra supportive of them, even more so, because they're the ones that are transporting the patient in a doors closed in a small confined area, where for us, sometimes those patients were able to come outside and we were able to treat the patient in the open air. But a lot of the patients are wheelchair bound, or they're bed bound, or they're non-ambulatory. So that was another huge issue as well. So there were a lot of factors that went into, are we all going in, or are we sending 2 in? Are we sending 1 in, you know, to that hot zone, as Captain Brainard had put that map up. So a lot of things changed. We had to be very flexible and be able to adjust on the fly.
One of the things, and real quick to tag on that, one of the things is the humanistic side of being a paramedic. One of the things that all of us love to do is, like, when I would go in, especially with the elderly population that were either, you know, a failure to thrive or chest pain or something where they're really anxious, they don't have anybody else. It would not be uncommon for me to take one of my gloves off and just hold their hand, because half the time that's all that was really needed, or it would help them get through that. Now we're going in with one person looking like a spacesuit, and the humanistic side of us taking care of it. I know for a fact, because I took a lot of these phone calls from our members where they're like, it's not fun anymore. Mm-hmm. It's not enjoyable to go do it. It's because we couldn't go. And that's one thing about our folks, is we love taking care of our people, going on those emergency calls where we can truly make that impact, instead of being able to go in and each one of us have our own style and, like, you know, how we can interact. Now we're with a gown, a mask, a shield, you know, 4 layers of gloves, and then like some sort of encapsulation thing on top of it all. And we lose the humanistic touch, and people don't understand how valuable that is across the board to have that.
Good point. I will have to say that I think everybody listening in made their own imaginatory scene of what happens when, Alma, you kick down the door unexpectedly in somebody's apartment. So I know I have a couple of scenes. I'm not going to say them, but I think we all had something in mind. But those are really good points about you know, the separation and not being able to you know, do the human touch. I know that a lot of us felt that just in our normal, you know, civilian lives. You know, the people at the grocery store can't smile at you and you can't smile back, that sort of thing. You know, but I think it must have been really accentuated when you know, part of what you do is to let somebody know that you're there and they're going to be okay. Now they're there to take care of them. And I can imagine that would have some effect to be separated from them by the PPE. Let me ask you about maybe a positive thing is, I know in the hospital, we saw so many people of the same type, you know, that, you know, people have had, you know, terrible lung disease, et cetera, that it really made some uniform practices, some improvement in our practices, positioning, maybe mechanical ventilation management, and infection prevention, that sort of thing. And I wonder whether there is something that happened in the first responders that said this is a practice that we adopted because of COVID, something we learned that, you know, maybe in the future we're going to keep this one.
I'll speak from my perspective. The infectious control. So remember I said this was a couple times a month, maybe a meeting here or there about infectious control. Then all of a sudden it morphed into 60 people looking at it. Once we put in the PPE, almost all the other exposures that we were going on plummeted. They almost went away. It was extreme rare. We would average about 40-ish, roughly, 40 to 50 a year exposures, and I'm like TB, meningitis, hepatitis, HIV, basically anything of a blood exposure, needle sticks, things like that. It went down to, I think, 5. I only remember the numbers. It was like, there's a single digit, 5, 7. Those are the numbers ringing the bell because we were wearing a proper PPE, our head to toe PPE. So, and that's one of the recommendations that's come out of the Health and Safety Office is PPE does work. So I know, and I apologize, I'm talking out both sides of my mouth. Remember on the 2 minutes ago, I flat out said, yeah, I'll take my glove off and hold the grandma's hand. But at the same rate, so there has to be a good balance. But I can sit there and say, you know, one of the things we have learned is the effectiveness of the PPE and not basically exposure. Because the first thing that in every EMT class, paramedic school, fire academy, EMS, when we're doing training is, you know, is the scene safe? Like what Alma was talking about, not having anybody else in there. I can tell you, being in operations, you know, my crew is my #1 priority. I want to make sure that there's nothing bad because we've been surprised on calls. And those are typically when the calls go ultra south. And those are the ones that hear national news. To not, yeah, it's serious. Like when first responders get killed or injured or there's attacks and stuff, it's because, you know, someone was hiding. And that is a real fear we experience. To having all that.
Just have a lot of us, you know, touch a lot of things. We touch our face, and it's amazing when you have, you know, PPE on and you go to scratch your face, you're like, oh yeah, I have a mask on, or oh yeah, I have gloves on. So it made us even more alert, I believe, to things.
Yeah, I think pre-COVID, certainly among healthcare personnel, anytime there was a published audit of how often people wash their hands in between patients and did, you know, just, you know, things that you would expect everybody would do just naturally. The usual numbers were less than half of the time that happened. And certainly I think, you know, in hospitals, I think it's 100% of the time now. I mean, I don't think anybody goes from a room to room without washing their hands. So that's a good thing.
It's changed our narrative, but in a good way, though. I think.
Let me ask you, we only have a couple of minutes left, but I know one of the concerns out in the public was that people were avoiding calling 911 when they should have. You know, I know that there was some statistic about the numbers of chest pain, you know, myocardial infarctions that arrived in hospitals plummeted in the very beginning of the COVID pandemic. And I'm wondering if that experience resonates with you all, that people were being reluctant to call 911 because of some fear of hospitals or something. Did you see that?
I'll speak. I wasn't in operations, so I'll let Alma touch on that. From what I remember, like I said, it's vague. I remember because that 2 months was a blur. If memory serves me correct, the initial March 13th was basically the day that everybody in infamy. That's when our world pretty much changed on March 13th. We had been hearing a bunch of stuff about that, but that was the day. If memory serves me correct, I want to say our responses were down the first about week. Like everybody said it was eerie quiet, mainly because they just didn't know. One of the things I can correlate this to when we had a last major decrease was the beginning of the Cedar Fire. So the Cedar Fire, the first about 2 days, engines stopped going on calls because we were all out fighting fire. But so all the ambulances left back in the city. We left one truck and one engine company for the entire city. They covered a plane crash. No one realized a Cessna went down to 163. And there was like 4 other calls that happened for like 72 hours. No one called. And so, and I want to say that that's what happened for about the first week. It wasn't 4 a day, but it was a dramatic reduction. And once everybody kind of got their bearings again after about a week, it all came back up. I personally haven't heard anything articulated that was due to the hospitals. I haven't read anything, heard any studies or anything like that. Well, I can say it was just that first week, everybody was kind of what's going on to kind of get the bearings. We've seen that through other major disasters within the city.
Dr. Lowry?
So I was on that one truck during the Cedar
Oh, you
fire.
were?
Oh, nice.
It was, yeah. It was truck 10. And yeah, it was this eeriness. It was quiet. The same thing when COVID, everything kind of just slowed down. There were days when we didn't go on any calls. And there was an eeriness about it. And it did resonate with me with the Cedar and the witch fire. I did encounter patients hesitant to go to the hospital, not wanting to go because they were afraid they're going to get COVID from the hospital. But I would spin it around. You know what? That's probably the cleanest place you're going to find is a hospital. And I would try to, it was a good education tool for us. And I know that things were ever evolving, but it was a good conversation piece to have with our patients. You know, please, please, we beg of you, don't hesitate to call 911. You know, if it's a question in your mind, then you probably should be calling, you know. But we had a lot of good conversation with patients out there, especially the elderly. They were very, very scared to go to a hospital.
Is it still happening now, or are things gone back to normal?
No, I wouldn't say back to normal, but there's also even more conversation happening. There's less and less of that. I'm scared to go to the hospital for sure. Absolutely. A lot of people would skip their doctor's appointments or didn't go to their doctor's appointments or keep up on their medication. So we saw people prolonging and then they would end up being sicker.
Yeah, that was certainly the feeling, and that was kicked around in the news too, that people were waiting till way too late before they called 911. But it sounds to me like maybe that's changing just a bit and back in the right direction.
Yes, for sure.
Well, great. Well, I think we're just about out of time now. So let me thank Dr. Brainard and Dr. Lowry. That was a really stimulating discussion about what's happening with the first responders and what your experiences were. And again, from our community, thank you very much for all the things that we do. And for all of you who are listening in, thank you for your attention. Next week, we'll be talking about lung cancer screening and how to do that effectively during the pandemic. Have a good night, everybody.